You have done everything right for your loved one. You made the difficult decision to trust a facility. You paid the high cost to ensure their safety and dignity. But I need to tell you a terrifying truth. The biggest threat to their well-being is often not their age or their pre-existing health condition. The biggest threat is preventable neglect. It is the silent killer hiding in plain sight in nursing homes across America. I am talking about the chronic and devastating reality of understaffing. It is a crisis so severe that, according to industry reports, nearly 94% of U.S. nursing facilities have struggled with staff shortages. Think about that number, 94%. It means the care facility you trust is likely operating without the people necessary to ensure safety. It means a loved one's call light is likely going unanswered. It means small, fixable problems are escalating into major, life-threatening crises. In fact, research shows that patients on understaffed units face a mortality risk that is about 6% higher than those on fully staffed units. I understand this is a frightening statistic, but I am not here to scare you without offering a shield. I am here to turn you into the ultimate advocate for your family. The system is failing. But we, as informed caregivers and as active seniors, do not have to fail. In this deep dive investigation, I will reveal how systemic understaffing transforms simple oversight into silent, deadly neglect. I will expose the 3 hidden physical risks that escalate rapidly when staff are overworked. And most importantly, I will give you the 5 critical warning signs that overworked staff often miss every single day. These signs are your early warning system. They are your checklist for peace of mind. Stay with me, because knowing these signs is the difference between protection and preventable tragedy. This is the hidden cost of the staffing crisis, and it is time for the truth. The silent physical risks, hidden harm. The core mission of a nursing home is attention. It is timely help, consistent care, and vigilant observation. When a facility is understaffed, that fundamental commitment shatters. The crisis is not just about fewer people. It is about a failure of attention. This failure creates 3 major physical risks that escalate rapidly in the absence of sufficient care. Risk number 1, falls and trauma. A fall is terrifying for any senior. It can mean a broken hip, a head injury, or a swift decline in overall health. But here is the hidden connection to understaffing. Falls are frequently preventable. They are often the direct result of delayed care. Imagine this scenario. A resident needs to use the bathroom. They push the call light, but the single certified nursing assistant or CNA on duty is busy caring for a dozen other people at once. The minutes stretch into 10, 15, sometimes 20 minutes. The resident is uncomfortable and feels the urgent need to go. They make the conscious, yet dangerous decision to get up by themselves. They try to reach the walker or shuffle to the restroom alone. This is where the fall happens. The CNA was not neglectful by intention. The system forced the resident into a desperate situation. Understaffing turns patience into a perilous decision for the resident. The lack of timely response directly increases the likelihood of a major fall and subsequent trauma. Risk number 2, malnutrition and dehydration. This is perhaps the most insidious silent killer in understaffed homes. It is subtle, gradual, and often mistaken for natural aging. Malnutrition in the elderly is devastating. It leads to sarcopenia, the rapid loss of muscle mass. It weakens the immune system and drastically slows the healing process. But why does understaffing cause this? It is often not that there is no food available. It is that the staff lack the time to provide the necessary support. Many residents need careful assistance with feeding, encouragement to eat slowly, and constant monitoring to ensure they are actually consuming enough calories and protein. When a CNA has 6 residents to feed at once, they simply cannot dedicate the focused time needed for that delicate support. They rush the process, or they simply mark the resident as finished when only half the meal is eaten. The same goes for hydration. Dehydration can cause confusion, dizziness, and further increase the risk of falls. Overworked staff may miss refilling water pitchers or fail to bring fluids to residents who cannot reach them easily. They miss the small, vital details of constant, gentle reminders. The result is a resident who slowly, silently wastes away, losing the strength needed to resist illness or recover from injury. Risk number 3, bed sores and missed medication. These two issues represent fundamental failures in routine care. Bed sores or pressure ulcers occur when residents sit or lie in the same position for too long. They need to be repositioned every 2 hours. This is a non-negotiable standard of care. But if one nurse assistant is responsible for 15 residents instead of 8, those 2 hours become 3 or 4 hours. A small red mark can quickly become an open, infected wound in a matter of hours. These are incredibly painful, difficult to treat, and can lead to dangerous systemic infections. The problem of missed or incorrect medication is equally grave. The process of administering medication is complex and time-consuming. It requires careful verification against patient records. When a registered nurse or licensed practical nurse is racing against the clock, juggling multiple high-acuity patients, the likelihood of a medication error skyrockets. A missed dose of a blood thinner, a diuretic, or insulin can have immediate, life-threatening consequences. These physical risks are not just bad luck. They are the inevitable high cost of a system that prioritizes cutting labor expenses over human safety. The failure of attention, emotional and financial cost. The physical toll of understaffing is clear, but the crisis also inflicts immense emotional and financial damage on both the residents and their families. This part explores the deep psychological cost and the unfortunate truth about the caregivers caught in the middle. The emotional isolation. When staff are stretched thin, the first thing to be sacrificed is human connection. A high-quality facility offers compassion, conversation, and emotional support. A severely understaffed facility can only offer basic task completion, if that. Residents who require assistance with daily tasks often face unreasonably delayed response times. Imagine ringing a call bell and waiting 30 minutes for help to simply use the restroom. The resident is left feeling abandoned, humiliated, and utterly alone. This lack of attention directly contributes to feelings of social isolation, anxiety, and severe depression. These mental health issues exacerbate physical decline, creating a vicious cycle. An isolated senior is a senior whose will to fight illness is weakened. This quiet, slow erosion of mental health is the hidden emotional cost of neglect. The caregiver's dilemma, the staff as victims. It is vital that we, as families, understand that the direct care staff are often victims of the same broken system. The certified nursing assistants who spend the most time with your loved ones are chronically undervalued and severely underpaid. Consider these facts. Many CNAs earn close to minimum wage, often around $15 an hour. Nearly half of all direct care workers rely on public assistance to survive because their wages are so low. They are given impossible tasks, caring for dozens of residents at a time. This results in devastating burnout, a high turnover rate, often 50% annually, and a moral injury. They know they are failing to provide the quality of care their patients deserve. They know the lack of time is leading to bedsores, dehydration, and isolation. Research even shows that these dedicated, overworked staff members report suffering from panic attacks and nightmares because of the immense, crushing workload. We must direct our frustration and anger not at these frontline workers, but at the corporate, for-profit systems that intentionally operate this way. The system is designed to maximize profit by reducing staff, knowing that the small fines for non-compliance are still cheaper than paying a living wage and hiring adequate personnel. This is the ugly truth of the industry. Understaffing is a strategic financial decision, not an accidental oversight. The caregiver's checklist. 5 warning signs and solutions. As a family member or caregiver, you are now the most important line of defense against systemic neglect. You cannot rely on state inspections or corporate promises alone. You must become a focused, informed, and empathetic observer. I am giving you 5 specific, practical warning signs that indicate a failure of attention and a serious staffing problem, along with steps you can take today. Warning sign number 1, the hydration and mouth check. This is the easiest sign to miss and the most critical for survival. The symptom: dehydration and a rapid decline in oral hygiene. What understaffing misses? A dehydrated senior often appears simply confused or tired, which is frequently misattributed to natural aging by an overworked staff member. Proper mouth care is often the first thing to be cut from a hurried routine. Your checklist action? Inspect the water pitcher. Is it full? Is it within easy reach of your loved one? If it is full, check the water temperature. If it is warm and unappealing, they won't drink it. Perform a quick mouth check. Do the lips look cracked or dry? Does the inside of their mouth look parched? If so, they are dehydrated. Check the teeth, gums, and tongue. Are they clean? Proper oral hygiene prevents pneumonia, which can be deadly for a frail senior. If mouth care is lacking, other essential hygiene tasks are likely being missed too. Warning sign number 2, the clothing and skin check. This sign reveals failures in both hygiene and repositioning. The symptom: skin integrity breakdown, unusual bruising, and soiled clothing. What understaffing misses? Skin checks require time and focus, time that overworked staff do not have. Soiled briefs or clothing left unchanged lead to painful skin breakdown and dangerous urinary tract infections or UTIs. Your checklist action: gently check areas of high pressure. Look at the tailbone, hips, ankles, and shoulder blades for any redness, discoloration, or warm spots. Redness that does not disappear after pressing gently is a pre-sore sign. Act immediately. Note their clothing. If their shirt, pants, or blanket appears noticeably soiled from the previous day, it suggests a lapse in basic hygiene and personal care. Observe bruising. While some bruising is normal, notice any abnormal or new bruising on the shins, arms, or head. This could be a sign of a recent unmonitored fall. Warning sign number 3, the environment and light check. This is your direct measure of the staff's response time and engagement. The symptom: a consistently unanswered call light or an empty water pitcher in the immediate vicinity. What understaffing misses? The environment should be a safe harbor. If essential items are missing or if the call light is flashing for long periods, it is a flashing red signal of a chronic lack of staffing. Your checklist action: observe the call light when you first arrive. Is it on? How long does it take for a staff member to arrive? Time this response. A wait time over 10 minutes for a critical need is unacceptable and dangerous. Scan the bedside table. Is their call light reachable? Are eyeglasses, phone, and reading materials within easy reach? If they have to strain to reach these items, they are at a higher risk of a fall. Look for clutter. Cluttered rooms are obstacles. If there are trays, laundry, or medical equipment left unnecessarily in the pathway, it increases the risk of a fall. Warning sign number 4, the behavior and mood check. This symptom highlights the silent emotional cost. The symptom: sudden, unexplained mood swings, increased anxiety, or a notable decline in willingness to socialize. What understaffing misses? Staff often dismiss irritability or sadness as a side effect of aging or medication. They miss the crucial context that these shifts in mood are often a direct result of chronic isolation and the anxiety of waiting for help. Your checklist action: document changes in demeanor. Has your usually cheerful parent become withdrawn? Are they expressing feelings of loneliness or uselessness? These are signs of depression rooted in neglect of emotional needs. Ask direct questions. Ask your loved one, how long did it take for someone to answer your bell today? And do you feel like you have someone to talk to? Never accuse the staff directly, but let the information guide your advocacy. Observe interaction with staff. Do they shrink away when a staff member approaches? Is the interaction rushed and purely transactional? True care includes a human touch and a moment of genuine conversation. Warning sign number 5, the unexplained decline. This sign connects the overall physical symptoms to the neglect. The symptom: unexplained weight loss, recurring UTIs, or frequent hospital visits. What understaffing misses? Understaffing creates a cycle of missed symptoms and delayed treatment that forces residents into the emergency room or the hospital more often. Your checklist action: track weight. If your loved one is still capable, encourage them to track their weight weekly or ask the facility for records. Unexplained weight loss is the clearest sign of malnutrition and is a major red flag. Check recurring issues. Are they experiencing their third UTI in 6 months? Are they hospitalized frequently for pneumonia? These recurring issues are often the result of chronic, low-level neglect, such as poor hygiene or missed meals, rather than new, acute illness. Review medication changes. Ask to see the medication administration record. Are there frequent missed doses? Are the times consistent? This vigilance is essential for preventing serious medical errors. Conclusion: the power of the informed caregiver. The truth about the staffing crisis in nursing homes is difficult to face. It is a tragedy driven by economics, where corporate profits are prioritized over human dignity. The U.S. nursing home staffing crisis is transforming preventable neglect into the #1 silent killer of elderly residents. But by becoming an informed, vigilant advocate, you gain the power to neutralize this threat. By learning to read the 5 overlooked warning signs that overworked staff miss every day, you become the most vital safeguard for your loved one. Your consistent presence, your careful observation, and your compassionate attention can quite literally save a life. If you are a caregiver, what is the single most concerning red flag you have encountered that families need to know about? Share your warning in the comments below. Remember, taking control of your health and the health of your loved ones is the ultimate form of self-reliance. If you are looking for practical, evidence-based ways to build strength and health as you age, I highly recommend watching my next video where I break down the 4 worst foods that destroy muscle over 60. We must always choose knowledge and preparation over fear. Thank you for watching. Are the times consistent? This vigilance is essential for preventing serious medical error. Conclusion: the power of the informed caregiver. The truth about the staffing crisis in nursing homes is difficult to face. It is a tragedy driven by economics, where corporate profits are prioritized over human dignity. The U.S. nursing home staffing crisis is transforming preventable neglect into the #1 silent killer of elderly residents. But by becoming an informed, vigilant advocate, you gain the power to neutralize this threat. By learning to read the 5 overlooked warning signs that overworked staff miss every day, you become the most vital safeguard for your loved one. Your consistent presence, your careful observation, and your compassionate attention can quite literally save a life. If you are a caregiver, what is the single most concerning red flag you have encountered that families need to know about? Share your warning in the comments below. Remember, taking control of your health and the health of your loved ones is the ultimate form of self-reliance. If you are looking for practical, evidence-based ways to build strength and health as you age, I highly recommend watching my next video where I break down the 4 worst foods that destroy muscle over 60. We must always choose knowledge and preparation over fear. Thank you for watching.